In the 19 years of democracy in Nigeria, the health sector has been experiencing different pros and cons. These policy analysts and health experts believe the health sector needs restructuring in order to be at par with counterparts.
Health is usually best from the local level. The problem is that it's like a pyramid. The pyramid sits at the base. The base of a pyramid supports it. But what we've done is we've turned the pyramid upside down. What happens when you turn a pyramid upside down? It falls. There's so much emphasis on federal government level. The best way to do this is to empower the ward level, the local government level, to take care of basic health.
A survey was done recently that showed that Nigeria that just 33% of our children are fully immunized, which is very bad. It was worse than that before. So there are definitely areas of improvement, but we still need to look at the structural issues. And I think those are the things that limit what we're able to achieve and what we're able to do with healthcare to moving it to where we're supposed to be and achieving these kind of outcomes that we want. When we are spending 3.7% of our GDP on healthcare, it's terrible. When people have to pay, when 75% of the time people have to pay out of pocket for healthcare expenditure, that's terrible.
Development and things that has to do with health and all that is really not rocket science. You go to some other climes to see what people do. If you want to compare to something that is classic, it's something that you can go to Dubai and see what they are doing, and then you see what is available in public hospitals. They are world-class equipment. They're world-class equipment. You go to those kind of places. You're not visiting private hospitals. You're visiting public hospitals. You will be amazed at what a people and a government can put together. We don't have anything like that here, and there's even no communicated strategy on things that are being done. Currently, as we speak, as we celebrate Democracy Day, the health worker under their age, they are on strike. They're on strike. So in terms of welfare for the people is an issue, in terms of infrastructure is an issue, in terms of setting up new things is an issue. So what can we celebrate in that particular regard?
In recent times, there have been rancors in the sector such as incessant industrial action, workers' welfare, inadequate health facilities, and insufficient health workers, among others. The question on the lips of many Nigerians is, when will these challenges be permanently addressed, especially the well-being of the masses?
Use your thumb and vote people who understand how to fix these things. To say the truth, our medical doctors have not been treated well. That's the truth. The hospitals are in deplorable condition.
Until we realize that as healthcare workers, do you understand? As healthcare workers, that every part, from cleaning the hospital, to ensuring that the patient gets the right medication, to ensuring that while the patient is there, the patient is comfortable, to ensuring that I collect the patient's blood samples and analyze it properly and make sure that the doctor who is treating the patient has the right information is important.
It is believed that proper structuring and welfare of the health workers will go a long way in addressing the numerous challenges confronting the health sector, especially from the local government level. Ibironke Airelovegbe, Core TV News, Lagos.